Louisiana's first Surgeon General will take on a new role in the federal government, a move that may raise concerns about vaccines across the nation and right here at home.
So a question raised is if Dr. Ralph Abraham's policy changes in Louisiana will carry over to the CDC.
I think the big concern for the country when it comes to its health care is that science seems to have been placed in an extreme backseat, and that we're seeing indications of vaccine guidance which are unfounded.
A Louisiana native will serve as the principal deputy director at the Centers for Disease Control and Prevention as Dr. Ralph Abraham, a former Louisiana congressman, returns to the federal government in a new way. The state's health secretary, Dr. Abraham, took on the role of Surgeon General in June 2024 after Governor Jeff Landry signed a legislative bill that created the Office of the Surgeon General within LDH.
They created the position of Surgeon General, which sort of was more or less of a pulpit for him to dictate actual health policy.
It's unclear if this new role at the CDC will allow for Dr. Abraham to craft policy changes on the federal level. Earlier this year, Dr. Abraham directed LDH to cease promoting mass vaccination and advised patients to talk to their doctors about vaccinations instead. Views our political analyst Greg LaRose says are similar to the current U.S. Secretary of Health and Human Services.
It does fall in line really with a lot of the overall views of Robert F. Kennedy Jr., sort of is really undermining the confidence that I think a lot of folks have in vaccines. So sort of to be determined. I still think Louisiana probably has to pay more attention to what's happening at the federal level with RFK Jr. as opposed to sort of watching what Abraham does in this number 2 position at the CDC.
And without a director at the CDC, following the removal of Dr. Susan Menardez and no indication yet of who will lead LDH, questions are still circling as to what's next for the state's health department.
You have Dr. Coleman Weiss III, who is sort of in that deputy position that I think his medical views align a lot with Dr. Abraham. And Doug Greenstein was brought in to kind of be the day-to-day manager of the department, more of the guy that says, okay, here's where we're going to devote our resources. It was Greenstein who really came to the forefront, for example, when SNAP benefits were cut and the governor wanted to go to this backup plan. Greenstein really was the face of the health department at that point. And I think he's going to be increasingly so as it involves how much money the state has to devote to Medicaid.
As of Monday, a successor to Dr. Abraham has not yet been named.